I'm Stephen Sommer. I'm President and CEO of the Colorado Hospital Association. And while you're going to hear from a great guy after me, and my job is to introduce him to you to talk about health careers, I cannot tell you from a personal standpoint of a better career. We need lots of people. You're in a state that's growing dramatically, and healthcare is an important part of our economy, and we want to make certain we have the right people in the right jobs so we can give the right care at the right time in the right place. We represent, as of today, 107 hospitals and health systems in the state of Colorado. Virtually every hospital and health system belongs to CHA. Half of our members are located in rural communities. Now, that's not half the population, but half of our members. And I mention that because you're going to be hearing from shortly one of the leaders in rural healthcare in the state of Colorado. And I'll talk a little bit about that in a moment. But we have 75,000 people working every day in Colorado hospitals, 75,000 compassionate caregivers making a difference for people who need care at that moment, some inpatient, some outpatient. And it's critically important we have the right people in those jobs, having a staff that's highly trained, energetic, and team-focused is the kind of people we're looking for so we can continue to do the things we do well. So thank you so much for being here. So my job is introducing the next speaker. He has more enthusiasm about what he does than I do, and that's a lot of enthusiasm. And that's Trampas Hutches. Trampas's day job is CEO at the Melissa Memorial Hospital in Holyoke, a hospital that actually is just getting ready this week to celebrate its 100th year in that community. Critically important for the success of that community to do that. Why do I say he's one of the statewide leaders? Because it's a tough job running a rural hospital in any place, let alone Colorado. You've got to be a jack of all trades. And this man is one. And he also provides a lot of time at our organization because we operate through volunteers, through the CEOs throughout the state being involved. And he's one of our go-to people when we need someone who can help make certain we're doing the right things for rural communities in Colorado. He's been in the healthcare field for 26 years, and he's actually had 5 careers in healthcare, starting at the bedside with a certified nursing assistant, to working in anesthesia, to working in radiology, to working in cardiology, and now as a senior leader as a CEO. So he's got the perspective that makes it so valuable when we bring someone in to help us think through policy issues. He actually, early in his career, wanted to be a farmer. We're glad he didn't go down that route. But there's a couple of characteristics about farmers that are important to note. Number one, you've got to have patience. And you've got to have patience in the job we do. And that's patience in a different way. Number two, you've got to take a long view, because the consistency of where you go strategically in organizations today is so challenging with the topsy-turvy world we live in terms of politics. And our world is a lot of politics, given that Medicare and Medicaid are a big part of our payment system. So the patience that he has taking the long view on things that he thought of maybe being a farmer is probably one of the keys of his success. And he has been enormously successful as a CEO. So it is my pleasure to introduce one of our healthcare leaders in Colorado, one of the healthcare leaders among rural hospitals, and someone who I think can share with you the passion that you must have if you're going to be successful in healthcare. So thanks for being here. Trampas, they're all yours.
Like Stephen said, what an exciting time to be in healthcare. With national unemployment rates of about 3.9%, in state of Colorado unemployment rate of about 2.8%, you are all truly in a good place to be here today. The healthcare sector, in my opinion, is the very best sector to be in. According to the United States Department of Labor September jobs report, of the 201,000 jobs added in August of this year, 33,000 were in healthcare. This year to date, there's been an increase of 301,000 healthcare jobs in the United States. In this great state of Colorado, healthcare and education jobs are counted together in the same category. Over the past 10 years, nearly 100,000 new jobs in this grouping have been added. I am also the current treasurer of the Holyoke School District Board of Education, and I can assure you very few of those are teachers, and that's another story. As I mentioned earlier, healthcare is the very best sector to be in. Where else can you have 5 careers before you turn to age 40, like Stephen mentioned earlier? I've been a CNA, exercise physiologist in cardiac rehab, cardiac catheterization lab technologist, anesthesia tech, radiology tech doing X-ray, MRI, ultrasound. Now I'm started administration as Chief Operations Officer and Information Officer, and I am Chief Executive Officer for Melissa Memorial Hospital in Holyoke, Colorado. Healthcare has one of the most diverse workforces of any industry. Healthcare facilities can have most talented entry-level workers with GEDs all the way up to the highest educated, skillfully trained surgeons, sometimes all in the same room. The majority of these positions require only a 2-year degree or associate's degree and make more money than most job seekers that have a 4-year degree. My daughter is a junior in high school with ambitions of being a dental hygienist, and that's music to my ears as being a parent, as all I have to pay for 2 years of college. So her salary range will be $65,000 to $100,000 per year. The cost of her education will be about half of that of a 4-year degree. So according to the National Association of College and Employers, the class of 2017 average starting salary for someone with a 4-year degree in other fields is about $51,000. There are also other 2-year degrees common in healthcare, as you all may know. Nursing has some, radiologic technology, medical laboratory professionals, and they all have similar time frames in their degrees and wages. So there are many different settings in Colorado where you can work in healthcare, and I've been in nearly every one of them. They all have the good, the bad, and the ugly. I like to classify these into rural and urban settings, as you may know. There are also a lot of difference and trade-offs between the two. Social and even aspects as well as wages. And the urban setting has all the amenities one could ask for, with plenty of social life and everything else you could imagine. But also has a higher cost of living, longer commutes. Rural settings have much more laid-back lifestyle. The cost of living is a fraction of urban. Wages can be higher, and my commute is just 90 seconds every day. But there's also no Starbucks and Nordstrom racks. So, working experiences can be quite diverse too. I've worked in level 1 trauma centers where resources were abundant. Highly trained care teams work together for care in a large volume of high acuity patients, hone my skills as a clinician. Conversely, I've had amazing experiences in rural facilities where it was myself, a lab tech, ER nurse, and a nurse practitioner running a trauma activation on a van full of 12 individuals at 1 in the morning, and with not a single fatality experienced. I've also worked in the closest healthcare facility to the Pine Ridge Indian Reservation in South Dakota and Nebraska, where the social determinants of health had and continue to have a major impact on the population in that area. Pine Ridge Indian Reservation is the poorest county in the United States, with a median yearly household income of about $3,000 per year. There is no industry, technology, or commercial infrastructure to provide employment for its residents, contributing to its 90% unemployment rate. There is a 70% high school dropout rate. Their teen suicide rate is 150% of the national average. There is an average of 17 people for every house, and most houses do not have running water or sewer systems. Last but certainly not least, the infant mortality rate is the highest on this continent, or 300% of that of the national average. Who can tell me what they think this does to the average lifespan of people that live on Pine Ridge Indian Reservation? Yeah, it's not good. The average life expectancy of men on Pine Ridge is 47 years. Women is 52 years. This is a prime example of why the United States healthcare system is failing today. Statistics show that lifestyle habits such as smoking, obesity, stress, nutrition, blood pressure, alcohol, and drug use account for 50% of the poor health outcomes in the United States today. The environment, such as what I mentioned at Pine Ridge Indian Reservation, accounts for about 20%. Human biology, which we cannot fix, is about another 20%. And the healthcare sector that we are in is about 10%. The United States does a poor job of managing the 80% of the healthcare that can be managed. And each of us as patients can do a better job of managing ourselves and lead the way to exceptional health and wellness. So I'm sure you all are asking yourself by now, what does it have to do with coming to get a job application, getting some free swag and everything like that? I think it has everything with what we're here to do today, because it's all of you that will be focusing on these problems. Healthcare in the United States needs to fundamentally change. Healthcare in the US costs way too much money. And I can see the looks of shocks on all of your faces. I'm a CEO, and I do believe we're outrageously priced. However, I argue that when you do have to use this, we do a pretty darn good job. Take, for example, the organization I serve, Melissa Memorial Hospital in Holyoke, Colorado. We have not had a hospital-acquired infection or surgical site infection in over 3 years. Our family practice clinic can get you a same-day appointment, and our patient satisfaction scores are 90 to 99th percentile. We boast an overall employment engagement survey of double the national average of 89%. Our medical staff engagement scores are also double the national average of 82%. And by the way, we have a booth, so we're looking for physical therapists too. So if you're physical therapists, we have a booth over there. However, our population health scores are still just mediocre. We must continue to focus on no longer being a hospital by ramping up our community paramedicine program that provides home visits to those who are at high risk for readmissions. We must partner with social service organizations to help on the 80% of the things that are manageable, that are not typical services in healthcare or hospitals. A few weeks ago, the Hospital Association had an amazing annual conference with an overall theme of disruption in healthcare, particularly to hospitals. New innovations that utilize broadband are threatening to replace in-person providers. Self-driving Teslas will be the new ambulances, and cell phones will be your new exam rooms. The future is looking to replace hospital rooms with home monitoring and telehealth options. Ancillary monitoring systems will continuously monitor health mechanisms, and the U.S. Postal Service will become the largest healthcare provider in the U.S. by converting portions of each of their health clinics into primary care clinics in each post office. Social determinants of health will finally be at the forefront of healthcare, and we will practice proactive medicine instead of reactive medicine. Hospitals and healthcare facilities will move upstream to figure out how to keep people out of the hospital. Everything I just listed are already happening today. We must change to meet the needs of our patients. These innovations are all very cool, but I believe the real investments need to be made in each of you. And each of us personally need to take ownership of the changes happening right now. Large changes will be key to making healthcare better in the United States. We need to change our mindsets, and we absolutely cannot accept the status quo any longer. I encourage all of you to develop an entrepreneurial spirit and seek out change needed to make the difference. Think outside of your box and remove your blinders from your day-to-day responsibilities in your job. Be open to change, or better yet, be the catalyst for change and lead the way. One of the biggest threats today in the US is the opioid epidemic. According to the CDC, there were 72,000 deaths last year due to drug overdoses. This death toll is higher than the peak yearly death totals from HIV and car crashes. These deaths are usually associated with long-term drug addiction problems that rip at the fabric that holds society, friends, and families together. This past spring at Melissa Memorial Hospital, where I serve, in Holyoke, we investigated our opioid problem, and we did have a problem. We quickly formed a team to take this problem head on. We implemented a strict pain agreement plan that focused on safety and misuse. We put into place a robust drug testing program. The Colorado Hospital Association's ALTO program that helps ERs prescribe alternatives to opioids in the ER is being implemented as we speak. We now have a physician that specializes in tapering all patients off of these medications and offer alternatives such as acupuncture in our clinics. And we stepped outside of our box to offer medication-assisted therapy on our own via telehealth when this physician is not on site to ensure our patients have access. We are losing money on this program, due to the lack of funding and reimbursement for these types of treatments. But we know it is our duty to ensure our community is healthy. The first day that we did this clinic, every single patient failed their drug test. So this validated our efforts. Now, even in its infancy, this program is responsible for 2 to 4 patients a month being tapered off narcotics, and they could not be happier. This is an example of what we must do for healthcare to be successful in the United States. We must break down the barriers that prevent optimal health of those we serve. For those looking to hire a new nurse or tech today, think outside of the box. To remain relevant, we must remove hiring restrictions that limit change and innovation, and hire instead for those inspired to take healthcare to the next level. Why not take a chance with someone with less experience, who is hungry, innovative, and ready to take on that task at hand? I challenge each and every one of you today to step outside of your comfort zone, embrace change, and disrupt yourselves to ensure our patients have the fullest and healthiest life possible. So thank you very much.